Dealing with separation anxiety in dogs. The challenges associated with separation anxiety in dogs can be both emotionally draining and disruptive for pet owners. However, gaining a comprehensive understanding of the root causes behind this behavior is crucial. This knowledge not only helps alleviate frustration, but also empowers owners with the tools necessary to effectively manage and address their dog's separation anxiety. Defining separation anxiety in dogs. Separation anxiety is a behavioral condition observed in dogs when they are separated from their owners, often manifesting within minutes of the owner's departure. While more prevalent in younger dogs, it is essential for all dog owners to be cognizant of the possibility of this condition developing in older dogs as well. Recognizing signs and symptoms. The signs and symptoms of separation anxiety in dogs are predominantly behavioral, becoming apparent when dogs are left alone. Common indicators include 1. Excessive panting and salivation. Dogs may exhibit heightened levels of panting and salivation, reflecting their distress. 2. Excessive barking or howling. Vocalization is a prevalent sign, with dogs expressing their unease through persistent barking, whining, or howling. 3. Destructive behavior. Dogs with separation anxiety often engage in destructive activities, such as chewing on door frames, which can lead to lasting property damage. 4. Inappropriate elimination. Urination or defecation may occur within the house when dogs are left alone, indicating their anxiety. Early intervention and consequences. Addressing separation anxiety is crucial not only for the well-being of the dog, but also for maintaining positive relationships with neighbors and landlords. Untreated separation anxiety can lead to 1. Property damage. Destructive behaviors, including chewing on belongings or structures, can result in property damage. 2. Veterinary emergencies. Ingesting foreign objects like clothing or garbage during episodes of anxiety may necessitate surgical intervention, posing risks to the dog's health. 3. Behavioral complications. Excessive self-grooming, chewing, biting, or licking can lead to infections and other health issues for the dog. Owners are encouraged to seek professional guidance to develop effective strategies for managing and treating their dog's separation anxiety. By understanding the underlying causes and addressing the symptoms promptly, owners can create a supportive environment for their furry companions, ensuring their well-being and fostering positive interactions within their community. Unraveling the triggers behind separation anxiety in dogs. The onset of separation anxiety in dogs can stem from various factors, often categorized into distinct groups that shed light on the complex nature of this behavioral condition. Exploring common causes of separation anxiety. 1. Behavioral factors. Dogs may develop separation anxiety due to behavioral issues, particularly when they struggle to self-soothe. This can be exacerbated by owners unintentionally reinforcing anxiety-inducing behaviors. For instance, excessive attention given to the dog before leaving or upon returning can heighten anxiety levels during these critical times. 2. Physical illness. Underlying physical illnesses can contribute significantly to separation anxiety. Dogs experiencing moderate to severe discomfort due to a health issue may find it challenging to cope on their own. Identifying and addressing these health concerns is crucial for effective management. 3. Old age and cognitive dysfunction syndrome, CDS. Senior dogs, and those grappling with cognitive dysfunction syndrome, similar to dementia in humans, are susceptible to developing separation anxiety. Symptoms such as house soiling and anxiety may overlap between CDS and separation anxiety. Night blindness, a common issue in senior dogs, can further mimic separation anxiety symptoms. 4. Environmental changes, alterations in the dog's surroundings, routine, or the introduction of new family members or pets can act as triggers for separation anxiety. Moving to a new location, changes in daily schedules, and other adjustments can unsettle dogs, leading to anxiety when left alone. Interestingly, separation anxiety in dogs adopted from shelters tends to surface 1 to 2 months after their arrival, showcasing the impact of recent environmental changes. Uncovering the causes, owners might unknowingly encourage behaviors that contribute to separation anxiety. Understanding a dog's background, especially for those with unknown histories before adoption, can be challenging. Owners may not have access to all the details of their dog's past, making it difficult to pinpoint the exact cause. Treatment considerations. While the underlying causes of separation anxiety can be multifaceted, ranging from behavioral to medical or environmental, identifying the trigger is invaluable for effective treatment. Professional guidance can aid in developing tailored strategies to address the specific causes and alleviate the distress experienced by dogs dealing with separation anxiety. Exploring medical and behavioral considerations in addressing separation anxiety in dogs. Before embarking on the treatment journey for your dog's separation anxiety, it is imperative to delve into potential medical and behavioral issues that might contribute to or mimic the symptoms of this condition. Understanding and ruling out these overlapping factors is crucial for devising an effective approach to address your furry friend's well-being. 1. Incontinence due to medical problems. Urinary incontinence, where a dog involuntarily empties its bladder, can lead to house soiling. Various medical conditions, including kidney disease, bladder stones, neurological problems, urinary tract infections, and hormonal imbalances, can cause incontinence. Seek guidance from your veterinarian to eliminate these medical concerns before initiating behavioral treatment for separation anxiety. 2. Medication side effects. Certain medications may induce side effects such as frequent urination or house soiling. If your dog is on medication and exhibits issues with soiling, consult your veterinarian to assess whether medication side effects could be contributing to the behavior. 3. Submissive or excitement urination. Dogs may involuntarily urinate during greetings, physical contact, play, scolding, or leash attachment, often displaying submissive postures. Recognizing these behaviors can help differentiate them from separation anxiety-related symptoms. 4. Incomplete house training. Incomplete house training, especially in younger dogs, may lead to occasional accidents indoors. Additional training may be required, or fear of punishment after urination might hinder the dog from going to the bathroom in the owner's presence. 5. Urine marking. Dogs may urinate indoors to mark their territory, a behavior commonly observed during environmental changes or the introduction of new animals. More prevalent in male dogs, urine marking can occur in females as well. 6. Juvenile destruction. Young dogs may exhibit destructive behaviors, such as chewing or digging, even when the owner is present. Addressing this common behavioral issue involves implementing effective training methods. 7. Boredom. Dogs left alone for extended periods may succumb to boredom, leading to destructive or disruptive behavior. Combat boredom by providing mental stimulation, such as puzzle toys, to keep your dog engaged during your absence. 8. Excessive barking or howling. Dogs may bark or howl in response to unfamiliar stimuli in their environment, irrespective of whether the owner is present. External factors like construction noise or new neighbors could trigger excessive vocalization. By carefully assessing and ruling out these medical and behavioral factors, pet owners can tailor their approach to effectively address the root causes of their dog's distress, paving the way for a more targeted and successful treatment plan for separation anxiety. Diagnosing and treating separation anxiety in dogs. A comprehensive approach. Diagnosing separation anxiety. Diagnosing separation anxiety in dogs relies on keen observation of their symptoms and behavior. Typically, these signs become apparent within the first 15 to 30 minutes after the owner's departure. Employing video recordings during this critical timeframe can aid veterinarians in the diagnostic process. Once separation anxiety is identified, the next crucial step is determining the underlying cause. This is particularly important as medical issues could be contributing to the condition, potentially indicating a severe health concern for the dog. Identifying the root cause is essential for effective treatment, often involving behavior modification for both the dog and the owner. While this process may take time, thorough diagnostics, including blood work and possibly imaging, may be recommended. In some cases, a referral to a board-certified veterinary behaviorist could provide specialized insights. Treatment approaches for separation anxiety. Addressing separation anxiety proves to be a multifaceted challenge, necessitating a holistic approach that encompasses medical considerations and behavioral interventions. 1. Medical resolution. If a medical condition is identified as an underlying cause, resolving the medical issue becomes the initial focus in alleviating separation anxiety. Anti-anxiety medications such as clomipramine, Clomicam, or fluoxetine, Prozac, may be prescribed, complemented by calming aids like pheromones, anxiety wrap, or thunder shirts. 2. Behavior modification. Regardless of the cause, behavior modification is pivotal for successful treatment. Collaborating with a trainer or behavioral specialist, recommended by the veterinarian, can help design a tailored plan. Key steps in behavior modification include increasing exercise and play, fostering independence, ignoring attention-seeking behaviors while reinforcing calm actions, adjusting arrival and departure routines to minimize stress, and refraining from punitive measures that can elevate stress levels. 3. Time and patience. Treating separation anxiety is a gradual process, and some dogs may struggle to reliably self-soothe. Alternative measures, such as utilizing pet sitters, enrolling in doggy daycare, or arranging for the dog to accompany the owner whenever possible, can provide interim solutions. In navigating the complexities of separation anxiety, a comprehensive approach that combines medical intervention, behavior modification, and alternative support measures offers the best chance for success. Patience and consistency in implementing the treatment plan are paramount to achieving positive outcomes for both the dog and its owner. Navigating medication and treatment costs for separation anxiety in dogs. Medication for separation anxiety. Before considering medication for your dog's separation anxiety, it is crucial to seek guidance from a veterinarian or a veterinary behaviorist. In severe cases, where dogs are profoundly distressed, medication becomes a valuable tool in conjunction with behavioral treatment. Role of anti-anxiety medications. Anti-anxiety medications play a pivotal role in helping dogs manage short periods of isolation, facilitating the overall progress of separation anxiety treatment. The medication, when used alongside behavioral interventions, aids in acclimating the dog to being alone, laying the foundation for a successful treatment journey. Weaning off medication. Over time, as your dog becomes accustomed to being left alone, a gradual reduction in medication may be considered. The decision to wean off medication should align with your dog's progress in behavior training, ensuring a smooth transition towards independence. Crate training and separation anxiety. Individual response to crating. Crate training can be beneficial for some dogs with separation anxiety, provided they perceive the crate as a safe haven. Monitoring your dog's behavior in the crate is crucial. Signs of distress, such as frantic escape attempts, continuous howling, heavy breathing, or excessive salivation, indicate whether crating is a suitable option. Alternatives to crating. If the crate induces stress, confining your dog to a single room behind a closed door or using a baby gate can be viable alternatives. Curing separation anxiety. Dependence on various factors. Curing separation anxiety is contingent upon factors such as the owner's commitment, the dog's response to training, and the identification of the root cause. Training, consistent routines, lifestyle adjustments, and, in some cases, long-term medication may be necessary for successful resolution. Contagion and secondary behavioral problems. Impact on humans and other pets. Separation anxiety is not contagious to humans, but it may evoke anxiety in owners and other pets within the household. In certain situations, other pets may mirror separation anxiety. Behaviors leading to secondary behavioral issues. Cost considerations, multiple visits and consistency. Treating separation anxiety requires ongoing collaboration with a veterinarian or behavioral specialist, often involving multiple visits. Consistency in treatment is crucial, and prospective pet owners should be aware of associated costs before embarking on the journey. Potential additional costs. Dogs with underlying conditions may incur additional expenses related to medication, monitoring, and diagnostics. Separation anxiety can result in costly property damage, emphasizing the importance of a well-considered routine and preventive measures. While separation anxiety is treatable, patience, financial readiness, and a tailored approach are essential elements in achieving positive outcomes for both dogs and their owners. Recovery and management of separation anxiety in dogs. Successfully managing separation anxiety in dogs requires a patient and comprehensive approach. While your veterinarian plays a crucial role in developing a treatment plan, there are practical steps owners can take to alleviate their dog's stress during this process. 1. Physical and mental stimulation. Frequent exercise serves as a valuable tool in tiring out your dog, both physically and mentally. Before periods of separation, training, exercise, and play sessions not only combat boredom but also strengthen the bond between owner and dog while boosting the dog's confidence. 2. Enrichment tools. Slow feeding bowls or toys can offer a tasty distraction, reinforcing positive experiences with solitude, especially during short absences. 3. Avoid reinforcing negative behaviors. Staying calm during departures and arrivals is essential to help your dog remain calm. Reinforcing exuberant greetings can heighten anxiety. Accidental reinforcement of negative behaviors should be minimized to maintain a calm and positive environment. 4. Tailored solutions for high-energy dogs. High-energy dogs may benefit from doggy daycares or engaging in dog sports to reduce stress and physical activity, diminishing separation anxiety's impact. 5. Consistency is key. Consistency in the application of training and management strategies is vital for successful outcomes. Resolving behavioral problems, including separation anxiety, takes time, and a lapse in consistency can set back progress. Preventing separation anxiety. 1. Socialization and positive experiences. Early socialization and positive experiences during alone time, facilitated through crate training or other techniques, contribute to a dog's ability to handle life changes without developing separation anxiety. Providing a designated safe place, such as a crate, offers comfort and reduces the likelihood of destructive behaviors. 2. Keep dogs active and stimulated. Active, stimulated dogs are less prone to developing separation anxiety. Regular training sessions reinforce positive behaviors and provide necessary structure. Routine exercise contributes to overall well-being and helps prevent the onset of separation anxiety. 3. Discourage needy behaviors. Discouraging needy behaviors, like excessive scratching or seeking attention, fosters independence and prevents over-reliance on the owner for comfort. Misconceptions about separation anxiety. 1. No vaccine for separation anxiety. There is no vaccine for separation anxiety. The condition is behavioral, and preventive measures involve training and positive experiences. 2. What not to do. Avoid punishing or scolding your dog for separation anxiety. This behavior is a result of distress, not disobedience. Positive redirection and understanding are essential for a more positive outcome. Conclusion: separation anxiety is treatable, and in some cases, preventable through early intervention, training, and behavioral modification. Understanding the unique needs of your dog and adhering to consistent management strategies will contribute to a successful recovery and long-term well-being.